today's lecture is about health assessment. That's the course we are doing, health assessment, but we are examining the integumentary system. The integumentary system is the one we are examining today. So in most cases, in the clinical settings, you are going to find that this is the patient who comes to your facility. Previously we did the history taking, right? Yes. So that prerequisite knowledge we have, even when we are examining this part, we are supposed to get that information, okay? So now when we talk about the integumentary system consists of the skin, the hair and the nails, and this is the largest organ of the body because it covers all the body organs, including inside. You will find that it will still cover even the body cavities. Then it provides variable information about all other body systems, the skin, the hair, and the nails will provide a clue about the general health status of the patient or the client, because before you diagnose to say this is the patient, you're going to call them as clients. So because of the integumentary system, cells reproduce it reproduces rapidly, and those changes are the ones that we are going to use. Those are the changes that we are going to notice, because one of the systems that reproduces rapidly is the integumentary system, the cells. No wonder we are going to find that the cells that are found in this system, we have the number of cells, because these they reproduce. Once they just finish their cycle, again they will continue reproducing, right? And now the other thing that we need to understand about this is that we also have to understand now the glimpse or the anatomy of the system, of the integumentary system, because we cannot talk about this system without knowing its anatomical structure and their functions, right? So we'll just go through the system. So this is what I have to demonstrate. We are going to find that this system, it has 3 parts, isn't it? The skin has 3 major parts, isn't it? But these 3 major parts, you are going to find that they are still in categories, right? So now, when we look at this, the outermost part of the skin, the outermost part of the skin is called what? Anyone? Yes. Yes? Anyone to tell us the outermost part of the skin? How do we call it? Yes. The epidermis, isn't it? So this is the epidermis. Now, when you look at the epidermis, for example, it has some corners, right? So the epidermis has 5 layers. Are we together? And the first layer we are calling is the what? The first layer we are calling is the stratum corneum. This one is the dead tissue. Okay? It's more like a dead tissue because there are a lot of keratin there. And keratin is a protein. Okay? Then the second one we are calling as the what? The stratum lucidum. Then the third one is the stratum granulosum and the stratum spinosum. Then the last one is the stratum dorsal. Then those 5 layers of the epidermis, they still have functions. Now, when you go down to the stratum dorsal, that's why you're going to find a lot of what? Keratinocytes, right? These keratinocytes, they produce what we call as keratin. And this is the keratin which moves up, going where? Up to the what? The stratum corneum, so that it makes now that dead tissue. It's more like dead tissue, but it has a very important function. This is the one which acts as the waterproof, okay? And it also reduces the rays of the sun that are coming into contact with the skin, so that it can also prevent it also prevents now the cancer of the skin. The other one which is being produced is the Langerhans. These Langerhans, they are also providing some functions such as now reducing those rays that are coming, so that there are no cancer cells that are being produced. Are we together? And also the Langerhans are also for the part of the immune system. Okay? Then the other thing that you're going to find, the skin color. When you look at me, I have a different skin color. It's because of the melanocytes. Melanocytes are produced from the basal. So these melanocytes are the ones that are producing melanin, and this is what? The skin color. Now, having an understanding on that, when you go to the epidermis, okay, when you go to the dermis now, the dermis has a lot of things there. You are going to find the blood vessels, you're going to find the root hair follicles, you're going to find The sweat glands. And the sweat glands are in two categories. We have the eccrine and the what is the apocrine. The apocrine, these are sweat glands that are in limited spaces. Okay, for example, in the axilla, you are going to find there the apocrine. But the other one, the eccrine, they are the ones that covers the whole body. Okay, then they are producing other things like the sebum and all those things. Okay, then you are going to find that apart from that, we have the root hair, isn't it? The root hair. That's where now we are going to find that the hair is going to develop from there. So even if you cut your hair, okay, still the root is what is intact. So it will still produce the same. The hair will still grow. Are we together? You are going to find the blood vessels because the tissues are supposed to be what? To be nourished, isn't it? So the blood vessels are going to provide the food, the nutrients, and everything for the what? For the nourishment of the skin. Okay. After that, other parts you can still research more and find the other parts. The other parts that you are going to find is now the last part, which is the what? The hypodermis or the subcutaneous tissue. The subcutaneous tissue, that's where you're going to find that even the origin of those blood vessels are coming from there. And this is the fat tissue, okay? So depending on how thick a person can be, maybe you're fat, you're slim like me, even the subcut does what? Changes, okay? It will become thick depending on the what? The body thickness or the body thickness. Are we together? So now, the other thing that we need to understand, we also have the nails, isn't it? The nails are part of the part of the what? The integumentary system. Now, the next thing that I would love us to understand is the interaction with other systems. Why is this integumentary system so important, such that if there is any underlying condition within the body, the integumentary system is going to be affected? For example, the respiratory system. The respiratory system, we are saying it provides oxygen to and remove carbon dioxide from the integumentary system. Number two, the color of the skin. That is under what? Respiration. So now, if the patient is not having sufficient oxygen, right, the system will still react, isn't it? How is it going to react? Number one, maybe there will be pallor, isn't it? There will be cyanosis, isn't it? Then the other system is the digestive system. We know that under the subcut, that's why there will be synthesis of vitamin D. And this vitamin D is important in the absorption of what? Phosphorus. Are we together? The other thing is it will supply now the nutrients while the skin will do what? Will keep or will store the what? The fat under the what? The subcutaneous tissue. That's the relationship. The other system is the lymphatic system, which is the first line of defense. So now, the Langerhans cells and the macrophages, they resist the infections. And the other thing is that the lymphatic system protects the skin by sending more macrophages and lymphocytes when needed. The other system is the endocrine system. We understand the endocrine system, isn't it? The endocrine system is dealing with what? The hormones. Okay? Now, when you talk about the hormones, for example, the patient who is suffering from a condition to do with, for example, maybe the thyroid, okay? Maybe there is high levels of production. There is production of what? The thyroxine hormone, right? You're going to find that the patient will start now going into the state of diaphoresis where there is excessive sweating. The organ which is affected is the thyroid. The gland which is affected is the thyroid gland. The system which is affected is the endocrine system. But when you look at that, what is the response? The response is coming in from the what? The results will be shown on the what? The integumentary system. Okay, because the patient is sweating. Okay. The other one is sex hormones that affects the hair growth, distribution, and also adrenal hormones that affect the dermal blood supply and mobilize lipids from the adipose, the adipocytes. Okay, urinary system. It's a system, very important system in our bodies. How is it related to the integumentary system? Number one, it removes the weight of a lot of waste products so that it can stabilize the what? The pH. Okay, the pH. Then the next thing is that it stimulates or it helps to eliminate water and waste, and skin prevents excessive water or fluid loss. The other interaction we are going to find is the cardiovascular system, which is providing nutrients and remove the waste, and also provide heat for the what? For the skin temperature. The muscular system synthesizing vitamin D for calcium and phosphorus absorption, which is needed, calcium which will be needed in the muscle contraction. The other system is the reproductive system. Probably you are going to find that this one will provide the sensory receptors for sexual what? Stimulation, isn't it? Okay, the other system is the skeletal system, which synthesizes vitamin D needed for calcium and phosphorus absorption. Then skeletal provides the framework of the skin. Then the next thing that you are going to find is the neurological system. This system, that's why you're going to find the sensory, okay? The sensory receptors in the dermis, the receptors to touch, temperature, pressure, vibration, and pain. Then it also provides communication with the external environment. So now, all these systems, they react with the what? This is the integumentary system. All these systems. The next thing that we need to assess, number one, when we are assessing this, there are certain things that we need to pay much attention to when you are assessing the integumentary system, or when you are assessing the what? The skin itself. There are certain things that you are supposed to. So if you are writing, you can still be taking note of that, but I will still send the notes. Number one, the skin color. How is the skin color? Okay? We need to pay much attention whenever you are assessing the skin color of the patient. There are people like us who are, I don't know if we are dark or what, I don't know the term you can use. Then there are also people who are light in complexion, isn't it? You need to differentiate, okay, because of the genes or the genetics. The other thing is there are lesions. Lesions, those are the bumps, something like a bump. If this is the skin, right? Then you find something on top, right? That is a lesion, isn't it? Okay, so you need also to assess for those things. You need to pay much attention to that. The other thing that you are going to find is the skin texture, the thickness. How thick is this skin? Maybe the patient is suffering from psoriasis, which is now building up of the skin. It is piling on top, and it becomes now very thick. But that is not the normal skin, isn't it? The other thing is the skin tag, okay, and hydration. Because when you say skin tag, for example, when I put the skin like that, how is it going back? Is it going fast or what? Because that one will lead also to dehydration, isn't it? The other thing is the skin temperature. The skin temperature we don't feel the skin temperature using the palm, isn't it? But the dorsal aspect of the what? The hand, okay? Then, there are other things that you're going to find in the notes that you're going to use. For example, you find some rash, okay? You find some rash. How are you going to differentiate that this rash is coming as a result of this, okay? Then you're also going to find some patches, you're going to find some papules, you're going to find a lot of things of which you're going to see them on a patient, okay? Now, having said that, when you are assessing the patient, the integumentary system, I want you to pay much attention on this aspect. When you are assessing the integumentary system, we only use two techniques. Are we together? There's only inspection and palpation. Are we together? We do not auscultate the skin. Are we together?
Yes.
We cannot auscultate the skin. We only palpate the skin and inspect. No wonder it is very simple, but it needs you to understand. Once you understand the anatomy of the skin, then you're going to know if I am palpating, why is it that I am feeling something that is rough on the skin? When you touch something, you feel like it is smooth, right? So you're going to find that it is very easy for you to assess the skin because you're just going to inspect and do what? Palpate. Now, I want us to differentiate what can we inspect on the skin and what can we palpate. Are we together? So now, you receive the patient, right? You receive the patient and this patient comes to your facility. For example, this is the first time you're receiving that particular patient. And since you have now received that particular patient, you need to take this. When you start inspecting, when you do the thorough physical examination, you're going to see how the patient is coming in, how is the patient walking, right? What are the features that you're seeing on the patient? Are you seeing something that is different from what you're supposed to see on the normal skin? Are we together? When you receive the patient, what are the things that you're supposed to do? What do we inspect? And those are the things that we are going to do. So having the background of history, the history taking that we did is the comprehensive. Are we together? But when it comes to the system, we are going to stick to that system. Even the history that you are going to get on the patient, it will just stick to that, to the system. Are we together? And that's where you are going to find that when you are getting, you are more likely to concentrate on the biography of the patient, okay? The biographic data. That's where now you want to understand the current health assessment or the current health status of the patient. Number one, the change in the lesions. If they have lesions, you are going to assess that. You are going to see if those sores that are there, are they chronic or they've been there for a long period of time. Is it because it was just, it's genetic? Because there are those papules that most of us, we have them, isn't it? They are dark in color. Just from birth, you will find something that has been just there until a person dies, isn't it? Then we also have, if the skin is itching, or maybe there is rash, okay? What is this rash? Or maybe there is hair change, okay? Not because the patient had dyed the hair, but maybe the hair has just changed, okay? Then also the nail changes. What could be the problem, right? But the first thing that you do, you need to get the vitals. Are we together? Get the vitals, collect the vitals. These vitals are including what? Number one, yes? Temperature. Number two, pulse. Number three, respirations. The blood pressure, isn't it? Okay. Then you're also going to get the oxygen saturations from the same patient. Are we together? Oxygen saturations are going to notice or notify you to say there should be a problem, because oxygen saturation is supposed to be between what? 93 to 100%. If it is ranging that, then it is okay. We have enough oxygen in the what? In the body. Okay. Then the other thing that you're going to get is the height of the patient and the what? The weight. These things are going to help you understand. Maybe the patient is malnourished, right? The patient is not feeding well. How is the height? Is the height correlating with the weight? Because it has to correlate. Are we together? So that you can even get the BMI from the patient. Okay. Now, I want us to receive this particular patient. So when you are inspecting, you are not supposed to don in gloves. Hello?
Yes, sir.
We use the clean gloves, but you need to do the hand washing. Are we together? Do the hand washing, but don't don in gloves. You're just inspecting. You're not touching anything. You're just inspecting. The only time you don in gloves is when the patient you want to palpate. Because now you are touching the skin. You are coming into contact with the patient. So you need now to follow the hygienic precautions where you need to don in gloves so that you cannot transmit the infections. You may have some infections. For example, the patient has maybe some cuts, right? Some wounds, and now you just touch the patient. Automatically, your normal flora will be in contact with what? The patient, and the patient can have other infections. And you know, when the normal flora goes into the place they are not supposed to be, they become dangerous and they will cause a lot of infections. Okay? So you can only don in gloves when you're what? When you're palpating. When you're inspecting, you're just looking at the patient. Are we together? The next thing that we need to understand also, this particular patient is not supposed to be inspected in his or her clothes. Okay? So if you have a patient, the female patient, you have, but you also need to understand the cultural aspect. There are some people who come to your facility and say, you cannot inspect me because I'm a female patient or I'm a male patient, right? So what do? You explain the procedure, isn't it? Whatever you're going to do with the patient will remain there because you have screened and you're going to do the procedure, isn't it? Unless if they insist to say, no, I cannot do this, because you need to appreciate also the culture. You can call another patient, another nurse to come and assess. Are we together? But make sure that the nurse who is assessing that particular patient is also competent with whatever they are doing. Are we together? Okay. So those are the things. So the patient is supposed to be undressed only to remain with something that will cover their genital, the genital area. Are we together? Then the patient is supposed to be in a gown, the hospital gown. The hospital gown which has where you tie it behind so that it has a zip. Okay? So that when you are assessing or you are inspecting the back of the patient, you are going to untie it and assess, or you can palpate whatever you have seen there. Are we together?
Yes.
So now at this point, I would love someone to be reading so that we can start now with the procedure. So now, we'll do it in that order, But when you're assessing, you can even do simultaneously. Are we together? You are assessing and palpating. But for the sake of learning, I want us to differentiate what are the things that we are supposed to inspect and what are the things that we are supposed to palpate on the what? On the body. Are we together? Okay. So you will start from inspection here. Inspection on the skin. You're just going down, eh? Okay. So before he starts, I need to do what we are going as what? And washing, right? Okay. You, your students, please, we need to do the normal hand washing. Okay. Then I need to go to the patient, isn't it? Now, when I go to the patient, if you are on the ward, you need to get the permission from the ward in charge. Then you go and do what? Now, this particular patient has come maybe to your office, to your OPD office, then you need to assess this particular patient. The only permission you are going to get is from the patient. You are going to explain, okay? Because the patient has something, the patient is presenting with some signs and symptoms. Probably maybe the patient has rash and the rash is so itchy and the patient is feeling uncomfortable. So you need to get permission from the patient, then you start explaining whatever you're going to do. Are we together? Yes. So I've done the hand washing. I need to go to the what? To the patient, okay? Good morning, sir.
Good morning, sir. How are you?
I'm all right. So my name is Mr. Mwenya. I'm Mr. Mwenya from this hospital, Rusangu Clinic, and I am here to assess your skin so that you can see or know what the problem is and see how far we can help you. You said your name is?
My name is Laone Tipe.
Okay, you're Mr. Laone. Yes. Which name are you familiar with? The name that you would love me to be using?
You can use my surname, Mr. Tipe.
Mr. Tipe?
Yes.
All right, so I'll be using Mr. Tipe. So now, I want us, I will screen for privacy, by the way, okay, so that everything that we are going to discuss here will remain here. Okay. So we'll maintain that privacy, and also we'll maintain that the things, you just have to feel comfortable, you feel free to participate. If I ask you something, you need to respond in a positive way so that we can see how we can help each other. If there is a treatment that will be needed after this, we will still go for further investigations. Okay, so is it okay that I can go ahead with the assessment?
Yes, I will.
So now what we are going to do is you remove your clothes so that we can put you in the hospital gown, which is clean. This hospital gown is going to help me so that I can assess you. So where I tell you to sit, because maybe I want to assess maybe the skin or the scalp or the hair, I'm going to request you to sit. Where I request you to sleep, I will request you to sleep. Where I request you to sleep on your tummy, we'll still do that. Okay. Right. So I've gotten the permission from the patient. I've explained what I want to do to this particular patient. So the next thing that I'm going to do is now to do what? To assess. Now, we are not going to do it in a hospital setup. I want us to learn this. Are we together? Okay, now. So what do we assess now on the skin? You can just read for us.
Alright, so
okay.
On the skin...
We are inspecting, isn't it?
Yes.
Okay, so what do we inspect?
We have to note the color, the contour, and the integrity.
Okay, so now we are going to note on this particular patient the color of the skin. Are we together?
Yes.
We also need to sometimes the skin will be smelling, eh? Maybe the patient didn't bath or whatever, all those things, isn't it?
Yes.
Because that way now it will tell you to say this particular patient, probably the patient hasn't been bathing, isn't it? The smell that is coming from the patient. Then the color. Maybe the patient is light in complexion. Now the patient has become, maybe, is it dark? Can I use the word dark? The patient has become dark because the patient hasn't been bathing. Are we together? Okay. So now you need to note the color. Now, on the same color, what are we finding? The first thing that we are finding.
The normal findings.
Yes, the normal findings.
It should be uniform skin color.
It should be uniform. The skin color should be uniform. Now, when we say the skin color should be uniform, we understand that the gluteal muscle, the skin is different, eh? It's a little bit dark, isn't it? But when you go to the thighs, you'll find that the skin also becomes a little bit light, isn't it? Especially in female patients, eh? So now, the uniform skin color, no wonder we are saying we need to address this particular patient so that the patient is just free, isn't it? You are free to assess. So now, I need to check the skin color. Is it uniform? For example, maybe on the forehead, it's a little bit dark, right? Maybe there's a scar. I'm going to differentiate that, isn't it? So if I find an abnormality in the skin, I am going to record. Maybe there is a scar, isn't it? A scar on the what? On the forehead. Are we together? So now when I see that the skin, I'm starting from the head up to the what? To the toes, so that I can notice the skin color. Are we together? When I start noticing the skin color from the face, how is the face? Because what you need to understand is that the way the face, the skin color of the face, and when you go to the neck, it changes a little bit, isn't it? It changes a little bit. You find that it is a little bit, if the patient is light in complexion, you'll find that the neck will be more light. And the other thing, the skin which is most exposed, especially the skin of the face, the skin of the maybe the upper extremities, you'll find that they're a little bit darker compared to the skin which is not exposed. Are we together? That's why you are going to find, but it should be uniform. Not where you find the face is very brown, right? The face is too light, but you go to the hands, very dark. You go to the knuckles, very dark. Then there's a problem, isn't it? You are finding some abnormalities there because maybe the patient has been maybe breaching. Is it breaching? Yes, the patient has been breaching. So now you are going to start noticing those abnormalities. Okay. So apart from the uniform skin color, what else are we going to find from there?
Yeah, there is no sign jaundice.
Okay, now jaundice, cyanosis. Jaundice, we are checking the sclera, the eyes. Are we together? So now I will inspect the eyes. I will just tell him to look at me. Then I see the eyes. Now I'm just going to the sclera. Are we together? If I see that it is yellow in color, then there is a problem, right? Because that is now jaundice. So on the skin color, I will say if there is a scar on the skin, I will mention that, or there is a scar on the forehead, or there is a scar on the abdomen, or maybe there is a scar on the thigh. Are we together? But when I see now for jaundice, I am going to inspect the eyes. I'm going to inspect and tell you the findings, write the findings. That the findings that I'm going to find on the skin, on the sclera, is that there is a yellow discoloration of the what? The sclera. Then that shows that it is jaundice. Then, if the patient is jaundice, the patient is not even complaining of something to do with maybe malaria or the fever or whatever, then I need to go on because during the history, I asked that particular patient, the social history, do they drink, right? If they don't drink, then they are of that. Then there should be some another system in the body which is being affected, right? So if I find that maybe the patient drinks, then I'll start suspecting to say maybe the liver is what? Affected. Okay? If the patient is showing the way the patient is looking like, for example, maybe the patient has malaria, you are going to say that probably the patient has what? Severe malaria. That's why there is what? Jaundice. Okay? Now, when you talk about cyanosis, you are going to the what? The lips. You can check from the lips. That's why you tell the patient, they can even open the what? Their mouth, so that you can check for central cyanosis, or you check from the lips. So cyanosis, this is why you find that the lips are looking, they are blue in color. Okay, that is now the bluish color of the what? The lips, isn't it? Now the other thing that we need to understand is that cyanosis will only come in because there is tissue hypoxia. Tissue hypoxia, that's where now we have low levels of what? Oxygen in the body, okay, in the tissues. So you are going to notice that probably the issue has to do with what? The respiratory system. Are we together? But where is the result? The result is where? On the skin. But the problem is inside. Are we together? So now if you find that the abnormal findings, if you find that there is jaundice, you will say there is this sign of what? Jaundice. That is on the skin, okay? Jaundice, because any clinical nurse who is coming to see, or any doctor, they are going to know that, oh, there is this, and if the problem is this, then you can go for further what? Interventions. Are we together?
Yes.
If there is cyanosis, you will say cyanosis is what? Is present. If there is any scar, any form of scar, there is any scar, then you are going to ask the patient during the assessment, during the inspection, to say, I'm seeing the scar on the forehead. Is it because you are bent or you are something happened? Then the patient is going to tell you to say, no, I was bent some times back and this is the scar. Are we together?
Yes.
Yes. What else is there?
Pallor.
Pallor. Do you know pallor? Pale. The patient is looking pale. Okay? Pale is in addition to what? Pale, you can even find it in anemia. Are we together? The patient will look pale, isn't it? Not a patient who is looking like the light skinned, they become a little bit whitish. But now, that one also differs with the geographical areas. the geographical areas. And now, in people who are dark-skinned, these things, they are difficult to see them. But you can now see them in those prominent areas. The lips, the mouth, you can tell the patient to open the mouth, then you can also do what? Check the eyes. Are we together? What else? Vitiligo. Vitiligo. Have you ever seen a patient with vitiligo? Yes. For example, we've seen the patient with vitiligo. So vitiligo, you find, for example, this face, right? Here it is just like that. Then the other aspect is looking like whitish. Okay, that is vitiligo. Yes, that is vitiligo. What else? So if you find that there is vitiligo, you will say presence of what? Vitiligo. You are writing. Are we together? What else?
So is vitiligo a symptom of hyperpigmentation?
So that is now hyperpigmentation. That's why now you are going to find that there are a lot of patches there. Okay. So now the hyperpigmentation will come in when you say vitiligo. Other aspect, there is the pigmentation is high, isn't it? Because of what? Because you are going to find that if the melanocytes are not producing enough melanin, then they are going to affect that. So you find that maybe the face is lighter than the other body aspect. Then you are going to record. So if there is vitiligo, you are going to say presence of what? Vitiligo. On the what? On the abnormal findings. But the normal findings, for example, this one, there is no sign of what? Jaundice. I'm recording, right? There is no sign of jaundice. There is no sign of cyanosis. There is uniform what? Color of the skin, isn't it? Those are the normal findings.
So there's also mucous membrane and conjunctiva pink.
Yes, the mucous membrane and the conjunctiva. When you look at your lips, they are supposed to be a little bit pinky. Hello? So this is where you will find, this is where you're going to find that if the patient has come with a lot of lipstick, a lot of makeup, right? You need to wash their face, please. Yes. You cannot inspect, even the nails, if they have put the nails, artificial nails, you need to remove them. Yes, you need to remove them. If they have come with makeup, wherever they are going, please tell them to wash their face, the lipstick, they remove everything so that you can see the normal findings. Because there is no way you can inspect the skin of the patient, whereas they have a lot of makeup, right?
Yes, sir.
Blue, purple, mixed. You need to wash their face, okay? Yes.
There should be no unusual odor.
There is no unusual odor, isn't it? The skin, the patient's skin is smelling okay. It's normal, isn't it? Unless if the patient hasn't been bathing or their hygiene is compromised, then you can say there is odor. And that one now, it gives you the access to say, so what am I supposed to do? This particular patient needs what? Bathing, isn't it? Yes, but you're not going to bath the patient because when the patient has just come, the patient will still go back. You're just going to give IAC to that particular patient, how they are supposed to take care of themselves. Anything on the skin when we are inspecting?
Skin intact, no suspicions of lesions.
No suspicious. So the lesions you find if you see on the skin, right? Yes, the lesions you are going to find that if there are something that is protruding, right? But when you look at his skin, there are no lesions, right? So there are no lesions. So if there are no lesions, the skin is okay. Okay. But now, when you're assessing the patient like this, you can tell them to be in that position, like the supine position, right? So that you can just expose the parts that you are examining. If you want to examine the patient's back, you tell them to do what? To turn, isn't it? Or they can be in sitting position, then you just get the gown, you put it back so that you can inspect. Are we together?
Yes.
Yes. What else?
That's all on the skin.
On the skin. Can we go to is it the hair now?
Yeah, the hair and scalp.
The hair and the scalp.
On the hair, you have to know the color.
The color of the hair, right? So if, more especially now, we have issues to do with female patients, right? Because they will come with the hair which is maybe purple, they have plaited purple, pink, whatever you plait, okay? So it becomes a little bit difficult when you are assessing. Are we together?
Yes.
It becomes a little bit difficult. Now, if the patient is like, okay, for example, this particular patient, right? So you need to get a comb, okay? You need to get a comb. So at this point, you need to wash your hands and do what? Donning gloves. You're just inspecting, right? You're just inspecting. But now, as we are inspecting, first of all, look at the color of the hair. How is the distribution? You know, a lot of ladies are experiencing where the hair here. When you look at this, there is no hair, isn't it? Yes, there is no hair. I don't know if it is genetic or what. Because of what? Because when you plait, so you should stop plaiting, right? Yes. So now you are going to find that at this point, you are just inspecting, isn't it? At this point, when you are inspecting the hair, you are going to look at the distribution. How is the distribution, right? For him, I'm just going to look at the hair. The hair, there is the normal distribution. Now, when you are checking, right? When you are inspecting, you also need to notice that there are also people who can come like they are bodied, isn't it? Yes. When you ask them, why is it that, is this, I don't know, you call it potato haircut or it's a body haircut? Body one, right? Yes. So you will see the difference. For the person who has a bald head, you're going to notice that even there is no hair there, isn't it? It's just genetic. They are just born like that. It runs through the family. But a person who comes, maybe it's because there is alopecia, right? Can we read the findings that are there?
Even distribution over the scalp, no alopecia.
Okay, so like when you look at this patient, the hair is what? Distributed normally, isn't it? Okay. No alopecia. Alopecia is what now? Alopecia is what now there is, you have no hair maybe here, and sometimes you find that patients who are suffering from, maybe who are on chemo, they have issues to do with alopecia, right? Because those drugs, when they are in the body, they start now killing or destroying the hair root, the root hairs. Okay, so there will be no hair coming. So you just find the hair will be just falling. Okay, you'll be just falling. So you can check, is this particular patient on some treatment? Why is it that there is alopecia? Especially for you ladies who are saying it's because of plaiting, right? Could be because of plaiting. That's why you don't have the hair, isn't it? So now you are not going to say this is now. You're not going to write the findings that this kind of hair distribution has some bit of alopecia, because you are able to see the hair is not just growing, isn't it? So that is not alopecia. Alopecia, there is falling of the hair. It is different from, you'll find here, for example, you'll find here, there is maybe normal distribution. The other part, the hair looks like it is not even looking healthy, right? Yes, the other part you find there is, so the hair doesn't even look healthy in alopecia. But a patient who has come with a bald head, you will find that if it is a bald, you will find that it is even shining, right? Yes. So there is no alopecia. So when I'm inspecting, under inspection of the scalp and this, I will say there is what? No alopecia, right? There is the fair distribution of what? There is the normal distribution of the same hair. Are we together?
Yes.
The next thing?
You have to check the condition of the scalp.
The condition of the scalp. So what are we finding on the condition of the scalp?
On the condition, there should be no lesions or pediculosis.
So now, do you know pediculosis? Do you know pediculosis? Those parasites, small parasites that will even jump, but you find them in the what? You know them now, right? Yes, the same lice. So now, lice, you will find that this particular patient, right? This particular patient, just looking at the patient, you can even see the lice what? Jumping from this part. So under the scalp, what are we inspecting? Am I able to see lice, right? Am I able to see lice? So now, if you're able to see lice, there will be presence of what? Lice, but that lice will not be written. So there is pediculosis, isn't it? Yes, so there will be pediculosis. Okay. So now, no wonder I was saying, at this time, we are trying to understand what are we supposed to inspect and what are we supposed to what? Palpate. So now, if you are doing it, the palpation and the inspection at the same time, you are supposed to be gloved, so that you can even do what? Palpate, isn't it? You can palpate even the what? Like this one, it's mobile, isn't it? This is normal. Are we together? This is normal. It is the scalp is what? Mobile. That's what you are going to write. There is mobile what? Scalp mobile, isn't it? So now, if you find that as you are separating the hair, you find that there is something to do with the same lice, which is pediculosis, you're going to record on the abnormal findings to say presence of what? Pediculosis, isn't it? That is a dermatological what? Condition. Yes. What else?
So on the hair itself, then it's done just in the normal findings. Again,
Yes, the normal findings, yes.
So there should be normal bulging patterns common to many elderly.
Sorry?
There should be normal bulging patterns.
Yes. Pattern, the pattern of the, especially elderly patients, eh? There should be normality. The baldness, that board, it should be a normal pattern. Are we together? You will find maybe the patient has a board from here up to the far end there, okay, up to the occipital. But for those who are coming in bald head, like the haircut, you should also notice certain things. Are we together?
Yes.
You should notice certain things, okay? What else?
Hair color appropriate, thins and grays with age.
Yes, so if you find that the hair, for example, I've gotten the information, this particular patient is maybe 30 years, right? But I find gray hair. I'll ask the patient, maybe the patient has just died the what? The hair. Or it's genetic. It runs through the what? The family. So if it runs through the family, I'm going to notice to say it's because of the what? The genesis. So it is not supposed to be what? The norm. No wonder when you are inspecting, the patient shouldn't even come with dyed hair. Are we together? You don't have to dye your hair. I don't know what comes over human beings. You just decide to dye your hair. Maybe for other professions.
The other one is fine body hair noted over most of the body.
Fine what? So now, when we say fine body, isn't it? The hair, because there's a statement that we need to understand when you're talking about the hair, right? When a person reaches puberty, hello, you will start now noticing certain things, right? Maybe there will be hair in the what? In the axilla, isn't it? There will be hair, the hair will start growing in the axilla. When you go to the pubic region, they will start now seeing some what? Some hair from there, isn't it? When you go to the thighs, you are going to find now fine what? The fine kind of hair. So that one, it should be normal. It's normal when you find those things, especially for a person who has reached what? Puberty. Are we together? Yes. So there should be fine distribution. So now there are all those patients who can come. You find that the whole chest. Maybe this is the male patient, right? The whole chest is here, isn't it? Or this particular patient is what? Is here. What do we do? That particular patient is normal for them. Are we together? So you're going to write the normal findings. It's just what? Fine what? Distributed what? Of hair all over the body, isn't it?
Yes.
Yes. So the other thing that we also need to notice is that you need to differentiate the patient, a pediatric and what? An adult, or a person who has reached puberty and a person who hasn't reached what? Puberty. Yes.
That's the statement which is gender, genetics and age can affect hair distribution, and puberty marks onset of pubic hair growth with increased hair growth on legs and axilla.
Exactly. So you will find also some patients, especially a female patient, right?
Mm-hmm.
Maybe I'm dealing with a female patient, and that female patient has some beards, right?
Mm-hmm.
Just because of the hormones. So it's normal. It's not because maybe they talk too much. No, those are just myths and beliefs. It's normal. Yes. Can we go to the nails?
The nails, yeah.
Yes.
So for the nails,
What are we checking on the nails?
The color.
The color of the nails. What is the normal color of the nails? I think there's a statement there down there. What should be the normal color of the nails?
It should be cuticle pink and intact.
Yes, cuticle pink and what? Intact, isn't it? You just tell the patient to do this, okay? Just do this. Then I start now checking. So now, for me, I'm seeing they are pink. The nails are pink, isn't it? What else? Those are the normal findings, isn't it? Yes. What else?
The condition of the nail.
The condition?
Yeah.
The condition of what?
Of the nail.
The nails. The condition of the nails. Now, there are those nails that are like finger clubbing, right? Because of hypoxia. So you will find the edge, this edge, it becomes big, right? Then the nail is making a curve going down, isn't it? It's a problem, please. Now, if you want to see your nails if they are in normal, you do like this, right? That's how they are supposed to be. Are we together? When you find something is protruding this side, it's going the other way, and the other way is going, then there's a problem. Are we together? But when you do this, when you look at it, you are supposed to see that it's supposed to be what? Normal. Are we together? So you just tell the patient to say, can you just do this? I'm just inspecting for finger what? Clubbing, because under finger clubbing you will find now the what? And other nails, the other thing is, you are going to find this spoon-shaped, especially in sickle cell disease patients. Eh? So the way the nail is going like a cave, isn't it? A normal cave. But spoon-shaped, it will go like that. How to get? So when you tell the patient to do like this, you are checking the nails. Now, when you are doing that, you as a nurse, you know that you are supposed to do what? Nail care. Check if the nails are kept normal, isn't it? Because there are some patients who come with long nails. How are you going to assess? It's difficult. Are we together? Yes.
We should note the angle of attachment.
The angle of attachment. The angle of attachment is from here because we have the lunula here, which looks like whitish.
Yes.
How is the angle of attachment? Is it normal? Is it at supposed to be? Is it at 160 degrees?
Yes.
Okay. Supposed to be at 160 degrees. Not going straight. Are we together? Now it seems like everyone is checking for their nails. Should be checking. Yes. The next thing.
Presence of focal or generalized abnormalities, e.g. ridges or clubbing.
Yes, the ones I was talking about. Those are abnormalities. Okay. The clubbing, they are the abnormalities. So those are the things that you can check. So now, if you find that the nails are okay, you just write the normal findings, isn't it? The normal findings. There is what the normal color, which is pink, isn't it? If it is pink, okay? The attachment of the nails is normal, okay? Normal attachment of the nails. There are no abnormalities such as what? Finger clubbing, isn't it? Yes.
We should note that.
Sorry?
You should note that.
We have ingrowns, nail ingrowns and hair ingrowns. How does that okay?
Sorry?
Ingrown.
The ingrown, the nails, isn't
and
it?
the hair.
Yes. So now, for those are the things that comes. Maybe the person was just born with them, right? So you are going to notice if you find that there is something that has come, okay, like the nail ingrown, then you are going to notice. You are going to ask the patient. If the patient was just born like that, then you are not going to notice as an abnormality. But that's how the patient was born. So that whenever you are, because you end up now cutting something that the patient was born with. Yes.
You have to know that nail color varies from pink to light brown in darker skinned patients.
Especially for us who have that color, isn't it? Mm-hmm. So they will be now changing from what? Pink to what? To light what? Brown. It's normal to find. Okay? We should be checking our nails, eh? If you see that your complexion is like mine, you should be checking. Okay.
Then we go to the skin.
The skin now, that is now palpation, right?
Yeah.
Yes, palpation. So the next thing that I'm going to do is what? Hand washing. When the hands are dry, what do I do? The next thing is to do what? I need to glove. But remember, I said, when you're assessing, for you to assess very fast, you need to do simultaneously. As you are inspecting, you are also doing what? Palpating. Okay, but for the sake of learning, we need to understand what do we inspect and what do we palpate. Okay, so I'll just ask the patient now to sit on the bed so that we can now start. Okay, so now you can just sit like this. Yes. Okay, so this is the patient, isn't it? I need now to start now palpating, isn't it? So what are we going to start? On the skin. Remember, the patient is in what? In the hospital gown. So what are we going to start now palpating?
We're starting with feeling the temperature.
So now the temperature, you are not supposed first to be gloved, isn't it? So we are going to feel the temperature from the neck, from here, isn't it? While you are not gloved. The reason is very simple. You cannot use the palm, but we use the dorsal aspect. Reason number one, the skin here is thin and it is highly sensitive. Are we together? No wonder even when they are cannulating you, you'll find that it's painful here because of the distribution of the nerves. So you are able to detect the body temperature. Are we together? Now, at first you did the temperature, isn't it? You got the temperature as one of the vital signs. Here I just want to check if the patient is what? The skin is what? If the skin is warm or it is cold. Are we together? If it is cold, then there is a problem because the skin is not supposed to be cold, but it is what? It should correlate with the temperature. So the normal temperature, what is there now?
Normal finding, skin warm and dry.
The skin is supposed to be warm and what? Dry now. Places that are exposed, you're going to find that the skin becomes a little bit dry compared to the places that are what? That are not exposed, especially the places that are covered, isn't it? So now this particular patient is in the gown. You're not going to be exposing the patient like that. Are we together? You're not going to be exposing the patient, but what are you going to be doing? You are only exposing the part you are working on. So now we are on the skin, isn't it? So the skin, I'm going to feel the skin, how the skin is. Is it cold? Is it warm? Just like that, isn't it? Okay, the next thing?
The next thing is tagger.
The skin tagger. So now the skin tagger, this is how we do the skin tagger, isn't it? Okay, I will do like this. This is the elasticity. We want to see if the patient is dehydrated, the patient is hydrated well. So now, when I get the skin like that, I leave it like that. It is going very fast, isn't it? Automatically, I need to understand that this patient is not dehydrated. The patient is what? Well hydrated, and the skin tagger is what? Normal, isn't it? Yes. So what are the findings? The normal findings on the skin tagger?
Positive tagger.
Positive tagger. So now you find that in patients who are dehydrated, the skin will be going back slowly compared to the patient who is what? Hydrated. So the patient we have here is what? Well hydrated, isn't it? Because there is positive tagger, isn't it?
Texture.
The texture. How is the texture now? We want to feel the thickness and the thinness of the what? The patient. Because why should we are palpating, by the way? We are palpating, isn't it? Yes. So now the texture. There are patients, there are some skin conditions that comes where the skin starts piling on itself, like maybe a person who has maybe there is rash, right? But that rash, it's something that is coming like you are able to feel it, isn't it? Okay? Or the person who is having psoriasis because the skin becomes thick, isn't it? So if the skin is thick, that is an abnormality, isn't it? So I'm going to record there. For example, I've seen the skin which is thick, isn't it? I am not going to diagnose to say, no, the patient has psoriasis. No. I am just going to write the findings, the abnormal findings, to say the skin is what? Very thick, isn't it? Because once I just say the skin is very thick and I've noticed something like there is the way the skin is, there are something that are unusual, that becomes the focus what? Health assessment, isn't it? That's why now I will start now from, so that I can see, because I've seen the sign and there should be some symptoms. So that's why now I will sit with the patient to do now a focused one. Are we together? This is a comprehensive health assessment of the integumentary system. But when I see that there is something that is unusual, I'm going to notice and write the abnormal. Yes.
All right, my question is, since we are palpating, right?
Yes.
We have to feel like the patient is skin.
Yes.
Won't those gloves disturb us when?
So the reason why we are putting on gloves is for hand hygiene, for hygienic purposes, right? They will not disturb. You will still feel it. Because they are very light, and you will still feel if the skin is very thick, or the skin has some pustules, the skin has some goosebumps, all those things. If the same pustules are filled with maybe pus, you're going to feel them, isn't it? You have already inspected. And now you are palpating to see what the problem is. Yes.
So, for the normal findings on the texture, the patient's skin is smooth, no scariness, and the skin thickness is normal. No obvious signs of dehydration or edema.
Okay, so now we are saying there's no edema, isn't it? Edema is swelling, isn't it? Okay. The other thing we are saying is there's no what? Scarring. There are no scars here, isn't it? So the skin is intact. So you just write the skin is what? In good condition. Where you now add no what? Edema. The patient is well hydrated, isn't it? The patient has the smooth what? Skin. Let's go to the next one.
The next one is palpate for tenderness and surface characteristics of any lesions.
So now when I'm palpating for tenderness, when I just do this, then the patient starts now feeling some pain, then there's tenderness, isn't it? The patient is experiencing some pain. So for tenderness, we are talking about the pain. Are we together? So when I palpate, I touch this skin, I touch here, okay? I touch somewhere, then the patient is saying, no, it's painful, isn't it? Which means, if the patient says, no, where you have touched is so painful, then the skin is the one responding to the what? The central nervous system or the nervous system. Are we together?
Yes.
Yes.
Then check for pulsation and branching of vascular lesion.
So for example, this particular patient has maybe this is the female who has some varicose veins. I need to palpate those. Are we together? Are they pulsating or they are not pulsating? So that I can see if maybe this particular patient just have an occlusion maybe within the blood vessels or there is something that has just caused that. Okay?
Yes,
So you palpate for those. Okay.
so you have to know that older adult skin may be drier, coarser, thinner with decreased texture and increase in lesions.
So for example, these are older patients, right? The older patient, the patient who is old, we understand that when you just pull the skin, how is the skin going to be going down? It will be slow, isn't it? Because there's no regeneration or reproduction of those new cells. Because we said the skin has the type of what? Labile cells. And these labile cells, they reproduce daily. They reproduce each and every time. Now, for these older patients, they are not what? Their reproduction has started reducing because of the age and other things that have just caused. So now, for them, the skin tag, these are adults, isn't it? So when you pull, the skin is going down very slowly, isn't it? So you have to differentiate when the patient is dehydrated and the patient who is not dehydrated but is an adult or they are in old age. Are we together? Yes.
Then we go to the hair and scalp.
The hair and the scalp, we can go. So what you are checking when you are palpating, you're not just palpating the hand, you're not just palpating the legs. The patient is in superimposition, then you are palpating. Are we together? If you are palpating, then you feel something that is more like it's a mass, okay? It's a mass, you have to notice that. Because maybe it's a mass which is cancerous. Are we together?
Yes.
Okay.
So palpate scalp for tenderness, masses and mobility.
You palpate for what?
For tenderness, masses and
I palpate like this, and the one we use for the skin is light palpation, eh? Not the deep palpation, isn't it? The light palpation, then we go like that, okay? Now, the mobility is where the skin is able, like, are you seeing the difference, right? It's normal, okay? This is normal, okay? So it's mobile. What else?
masses.
The masses. So the masses is where now we are going to find a solid mass, isn't it? As I am palpating the head in the scalp, then I find that there is something that is hard, isn't it? I am going to notice that that is now an abnormality, isn't it? It's not supposed to be there, okay? The tenderness, this is when when I palpate like that, the patient is feeling maybe some pain, then we know that there's a problem, isn't it? So the normal findings, this is mobile, isn't it? There are no scars, okay? There are no what? There are no masses, isn't it? Then when I'm also palpating, okay, I also need, maybe I can go ahead, where now, if the patient has come like they are fair, isn't it? I need to what? To separate the hair and check for what? For the lice, isn't it? Or for pediculosis, isn't it? I also need to check for those things. Are we together?
Yes.
Yes, just like I inspected. Now, at this point, I am not checking for those things. What am I checking? If there are some masses, okay? There are some, maybe there are some masses, I need to check for those things, okay? Maybe there are some pustules, or maybe the patient is suffering from maybe pseudofolliculitis, where you find that those things, especially when you shave, then you find they are hard, isn't it? You also check for those things, okay? Maybe a patient who has a bald head, you can check for those things. Okay?
You have to know the texture of the hair.
The texture, isn't it? The texture, is it thick? Is it thin? Because this is supposed to be a little bit thick, isn't it? And it's supposed to be medium thick, isn't it? Okay?
Texture and capillary refill.
Texture and capillary refill, is it the nails?
Yes, the nails.
Okay, so the nails. So for capillary refill, we do like this, isn't it? I'm palpating. This particular patient, I'm going to put some pressure there, okay? So when I'm putting the pressure, you'll find that it becomes a little bit light brown, isn't it? then within 3 seconds it starts to go back to normal. So if that is now the capillary refill. What are we checking for the capillary refill? We want to know, is the patient having enough oxygen? How is the blood circulation? All those things, isn't it? So if the capillary refill is good, you will notice to say the capillary refill is what? It's good. Okay?
For the normal findings for capillary refill,
Yes.
nail smooth and firm, no ridges at nail to nail base.
Yes. So that's why now you're going to find that where we are saying to say if the patient has these artificial nails, you need to remove them, right? So that you just remain with the normal nails. That's how you can get the normal findings.
Yes, yeah.
Is that the end?
Yeah.
So that's how you can inspect or you can examine the skin or the integumentary.